Good morning and welcome to Living Local 15. I'm your host, Jessica Williams. Thank you so much for tuning in today. I have a special show for you. I am outside of Femme Medical Spa, which is a brand new practice that just opened up in Fort Wayne. They're so unique because they offer a combination of gynecology services and medical spa services. Now I'm going to go on the inside, speak with their doctor and founder about why they had this vision, about the services you can get here and what makes them so unique, in addition to seeing their beautiful facility. And you're invited. Let's do it.
Fashion, food, and fun. You're watching Living Local 15 with your host, Jessica Williams.
This segment sponsored by Femme Medical Spa. I am now joined by Dr. Ashley Scott, MD, who is the founder here of Femme Medical Spa. Hello, doctor.
Hi.
How's it going?
It's great, thank you.
Good. Well, I'm so thrilled to be here. Congratulations to you. This is a really big deal.
Yes, I'm very excited that I could bring this vision to life and bring it to the community here in Fort Wayne.
Yes. Okay, so you are a native of Indiana.
Yes.
And so you had this idea to bring this new concept, I would say, this fusion between the medical and the spa side. So tell me about Femme Medical Spa, just an overview.
Okay, so this vision was really born out of a patient experience that I had early on in my career. I had a patient who couldn't get pregnant, and coming to our traditional OB-GYN standard practice, it was triggering for her to always be reminded, of that painful experience. So out of her frustration came an idea for me to create a space where women like her could get the comfort and the care that they needed and maintain some dignity along their healthcare journey. And in addition to that, as I was envisioning Femme Medical Spa, I wanted to look past medicine, and I got some inspiration from the luxury hospitality space. So from the smell that greets patients as they walk through the door, to the colors on the wall, and the fabric selections, to the classical music that they'll listen to as they sip their tea in our waiting lounge, I wanted to make sure that every detail was taken into account.
Oh, absolutely. When I walked in, I said, this is my heaven. I said, it's everything that I love. It's pink and it's luxurious.
That's exactly the moment that we wanted to evoke. So,
yes, okay. And so with the services that you offer, in combining the medical and spa side, you are still offering traditional OB-GYN services, correct?
Yes. So that was important for me because a lot of my patient population is in the menopausal age range. And as I'm addressing their healthcare needs, they're still experiencing a lot of changes to their physical appearance as well. And that can be difficult, because they want to make sure that they're staying, young and fresh as well. And so I wanted to make sure that their experience here at Femme Medical Spa would encapture all of their needs. So while I can do your pap smear, I can do surgery if you need it as well, but we can also take care of your skincare needs. And if you've lost weight and you just need some extra help, building up that six-pack, if you're interested in that, then we have devices that can do that as well.
That's incredible. Yeah, so you really do have the full gamut of things.
Yes, it was my goal to make this a one-stop shop for women.
Yeah, absolutely. From, like you said, the services that you provide as a gynecologist to the actual face. From different treatments that you have for the skin to fillers and Botox, and then, like you said, the weight loss journey that you take people down. And so I would love to kind of walk around, get a vibe of the place, and explore some of the treatments that you have here.
I'd love to show you.
All right, let's do it. All right, I'm so excited to see. Such a vibe.
Thank you.
Right.
So this is our nurses station. So this is where our staff will spend their downtime in between patients. We wanted to keep it light and airy so that they can still see what's happening in the hall and as patients are finishing. And then as we come around here, this is my office, which I happen to love
It
pink
is
and green.
beautiful.
Thank you.
Oh my goodness, such a vibe. So modern.
Yes, thank you. And so this is like my most favorite moment here as we
Okay, I'm
enter
excited.
around here. So in our procedure room, and actually in all of our gynae exam rooms, you'll see this big flower wall of wallpaper. And I just felt it's already uncomfortable for women to have to come and, you know, experience a pelvic exam. So how can we make that experience less cumbersome for the patient? So I wanted to give them something beautiful to look at, and we wanted to make sure we kept the open shelving to make sure it felt nice and warm and comfortable. And all of us women, we do the same thing. You go to the gynecologist, you get undressed from the waist down, and you're like, what do I do with my clothes?
Try to hide your bra.
Yes, we're always putting them in our purse. So I wanted to make sure we took that into account, and we built a patient locker so that patients will have somewhere to keep their belongings.
Very smart. Love the flower wall.
Thank you.
And yeah, it's just this whole vibe. I mean, it's just given this really nice, relaxing, plush pink.
Yes, that was our whole intention. We wanted to make sure when women stepped their foot in the door, they knew that they were going to be cared for, and this space was going to be comfortable for them.
Yeah, great. And then you have all the exam rooms here. So this side is the medical side, while the other rooms are the treatment sides?
Exactly.
Okay.
So we are a full scope practice here. Every need that a woman has can be taken care of here. We are truly a one-stop shop for women.
Yes, okay, I love it. Okay, let's keep walking. Oh, such a big space.
Yes. You know, I'm so happy with how it turned out.
Yeah.
And finally, like, this was just my added little special touch of Georgia O'Keeffe, who happens to be one of my favorite painters. I love her artwork, and I felt like it was just perfect for this space because these flowers are very reminiscent to, you know, the womanly body, and I wanted to bring in that element. And she's just been my favorite painter ever since high school. So
Yes, well, this place is very well thought out.
Thank you.
Yes, okay, so I'm so excited to learn about your different treatments.
Yes, so let's go see a treatment room.
All right, let's do it.
Follow us on social media at Living Local 15.
Welcome back. If you're just joining me, I am here at Femme Medical and Spa, and I'm joined by their founder, Dr. Ashley Scott. Hey there.
Hello.
Okay, so we're having so much fun just learning more about your new facility that will be opening up soon, which is exciting, and also learning about your treatment.
Yes.
So what will we explore first?
So first I want to take you to our M-Sculpt Neo device. So it's great for burning fat and building muscle. So anyone who has like any stubborn areas anywhere on their body, really, you can utilize our device and get that desired outcome you're looking for.
All right, let's give it a try. Okay, Dr. Ashley, we're in this room, and so walk us through.
So we have Sakia and Sydney here. They're performing an M-Sculpt Neo procedure on this patient. So this is to help burn any of that visceral fat that's deep. It also helps to tighten your muscles and does skin tightening as well. 30 minutes on this machine is equivalent to 22,000 sit-ups.
Wow.
In addition to every treatment area, you're losing 30% of the fat in that area and gaining 25% muscle. So I often tell patients 4 to 6 treatments of this is equivalent to 12 to 16 weeks of high intensity interval training.
Wow.
So very good results with this.
Okay, awesome. Let's see how it works.
So yes, they'll just place the applicator underneath these bands. They place it really snug against the patient's skin. You want to make sure it's flush against the patient's skin. And the patient just lays there. So this is so much better than going to the gym and doing those 20,000 sit-ups. And that's it. You turn the device on and we just start to ramp it up. Go ahead.
doctor.
Okay, are you ready?
I am. Okay, so I have something in my hand.
So that's just our little panic button. So if you started to notice that things were more intense than what you felt like you can tolerate, you just press that and it'll stop it.
Okay.
But we'll start really light with you, and
Okay.
then we can grade up the intensity as you feel it's appropriate.
All right, I'm excited to see what this feels like. You say, wait, 20,000 sit-ups?
20,000 sit-ups
Let's
in
do
30
it.
minutes. Yes.
Ooh.
You feeling it?
Yeah, it's nice. It's a warm sensation.
So there's electromagnetic energy that is causing what we call super maximal contractions. So it is the most that any muscle can contract at any given time. And you're also getting some heat, radio frequency heat. And so together, that's what's causing all of that fat to melt away. It's increasing the strength and building up muscle for you, and also tightening the skin.
Okay.
Yeah.
That's exciting.
So we can always take it up if you want us to take it up.
Take it up.
Take it up.
Yes. And one thing that you said that stood out is that this is a procedure that people can get in between, like on their lunch break. It's something that doesn't require downtime.
Right. So that's another reason why I love this device, because it's quick, it's easy. You know, you're going to be able to get this in, and then you go home after work. You don't have to do your workout because we've already done it for you.
Oh.
So.
All right, I just finished my treatment.
What did you think?
Okay, so it was very easy to do. Like, I honestly felt like I wasn't doing any work.
Exactly. That's the beauty of it.
The machine was doing it. It felt warm. It was fully heated. It was vibrating, pulsating, and I made it up, I think, to the highest level, right?
You did, and you completed the full therapy on the highest level, so good for you.
All right.
Yes.
Ooh, it was really good. So now I'm excited. I just completed 20,000 sit-ups.
20,000 sit-ups in 30 minutes. You're good to go.
Okay, yeah, I love it. I'll definitely do this again. You say you can do it once a week, four treatments.
Four treatments, and then we obviously want you to come back for maintenance treatments every few months or so, just to maintain that built-up muscle that you've already built.
All right, M-Sculpt Neo. All right, on to the next.
Okay.
Hello. All right, so what do we have here?
Yes, so here we have Marita. She's getting an M-Face procedure. And this is Drew and Taylor. They're going to be assisting us today. So M-Face is a device very similar to the M-Sculpt, but for the face. So we have applicators that you can place on your forehead, your cheeks, under the eyes, under the submentum. And the goal of this treatment is like a needleless facelift. So it will tighten the skin, it will take away those fine lines and wrinkles, it helps to build collagen and elasticity, so it gives you that more radiant, youthful appearance.
Okay, which is so important.
Yes.
Okay, how exciting. Okay, so just walk me through, so after the paddles go on, what is the sensation that the patient will be feeling?
So it's almost as if you're just cheesing and relaxing. So if you practice that, it's just a tightening of these muscles. So there is no pain associated with this at all. You just feel like your muscles are just squeezing a little bit.
Okay, so all this time I thought that smiling big was giving me crow's feet, but it's actually good, right?
Yes, you want to keep doing that motion, but you know, if you are noticing crow's feet, come and we'll put a pad on and we'll take it away for you.
Okay, I love it. And then what is the frequency that someone should do this procedure?
So you can do this treatment once every week or 2 weeks or so, depending on, you know, we usually say the number of treatments depends on how many decades that you have been with us. And once you've completed your full treatment course, then you'd still want to do some maintenance therapy every few months or so. And then you also want to make sure you're maintaining a good skincare regimen as well.
Okay, and what is the main takeaway from this? Like, what is the difference in skin that the patient will see after this machine?
So I love this machine in particular for women who are, going through that menopausal transition or who have just lost a significant amount of weight. You can lose some of that definition, so you'll get a more contoured appearance in your face. It'll leave that skin feeling more radiant, more hydrated as well. But you don't have any downtime.
Okay.
Yeah.
I love that. And you said something important, collagen.
Yes.
That's something that we need.
Yes, you need that collagen to build you that
Yeah.
structure into your face. And so as we get older, we lose a lot of that. We're actually starting to lose it as early as our 20s. So doing these procedures is great for prevention and maintenance.
Okay. And how long does this procedure take?
So this procedure is about 20 to 30 minutes, depending on where you're placing the applicators.
All right. Awesome. On to the next.
Living Local 15, proudly driven by the Kelly Automotive Group.
This segment sponsored by Femme Medical Spa. Okay, so we were back in the beautiful floral wall room.
Yes.
And you have a special chair here that is part of this M-Sculpt, chain. So tell me about it.
Yes, so this is the M-Cella chair, and this is really why I fell in love with all things aesthetics, essentially. So urinary incontinence affects about 1 in 4 women, and it's especially notable after pregnancy or in that menopausal transition. But men also are affected by urinary incontinence as well.
So what is that?
So that is when there is leakage of urine that is involuntary.
Oh.
Yes, so you can treat that with medication, with surgery, or now you can treat it with a chair, which is wonderful.
Yeah.
So 28 minutes in this chair is equivalent to 11,400 Kegel exercises.
Oh, the Kegel. Okay,
Yes.
got it.
So as a gynecologist, I am always encouraging my patients and reminding them, don't forget to do your Kegels. And a lot of times we're gonna forget, right?
Yeah.
And usually I only ask them to do about 30 a day.
Okay.
So, if you can't remember to do that, it's kind of like, you're messing up your pelvic floor. And so the beauty of this chair is, okay, well, you don't have to worry about it anymore. Let the chair do it for you.
Yes.
You sit in it fully clothed, it's pain-free, and 28 minutes, you've done what we've been asking you to do for years.
Right.
And 28 minutes, so.
Yes.
yeah.
And so just in your professional advice, you say people should do like 30 a day, but what age should they really start to focus on making sure that they're practicing this?
So I usually tell patients, once you are like in that childbearing age, or once you've had your first baby, whether it's vaginal or C-section, your pelvic floor is starting to become impacted.
Okay.
So usually, I'm encouraging patients to squeeze, hold it for 10 seconds, and then relax.
Okay.
And it doesn't have to be all at once. You can spread them out throughout the day. But, it's something that if you're not already in the habit of doing, it's very difficult to get into that habit. So.
Okay, and so and for the Kegel, for people who don't know, like you said, it's a process of squeezing in our vaginal area.
Yes.
Okay.
So you squeeze. I usually tell patients, imagine you need to go pee and you need to hold it. How would you do that?
Okay.
So if you are having a hard time activating those muscles, that's what you want to think about. But even as you squeeze, your muscle immediately starts to weaken.
Okay.
Because you only have so much control over that muscle. But the beauty of this chair is that it gives you what we call those super maximal contractions. So it can give you the most squeeze that a muscle can do at any given time, and it can sustain that.
Okay.
So it really helps to tighten that pelvic floor.
Okay. All right. Well, I'm going to give it a try. You already know, and let you know what it feels like to do this ultra Kegel machine. Okay.
Yes. And David, our nurse practitioner, he's going to get the machine going for you. Yeah, you see the chair starting to light up there. So 95% of patients who experience this chair report a significant improvement in their urinary incontinence.
That was very interesting. Like,
Yes.
it seems so easy.
It is really just that easy.
Yeah, just light vibrations. It wasn't uncomfortable at all.
Nope. And so I think anyone can come in here and sit in this chair, and it is life-changing, truly.
Yeah. Well, awesome. Well, thanks for giving me a sneak peek
Oh, I'm
of the services.
so appreciative that you stopped by, and we look forward to, you bringing your friends back with you.
Yes, because there's so many opportunities. So first off, right now you are accepting appointments.
Yes, we
which
are.
is exciting.
So patients can go to our website and schedule, and if they can't get through there, they can call us here at the office.
Okay, and then you officially start seeing patients on June 2nd.
June 2nd?
Yes, but we have to tell people about the special grand opening party that you're going to have.
So we are hosting an open house event on May 22nd. Patients can come in, they can demo all of the devices that you tried today, and we have other ones that they can try as well. We're doing special promotional pricing for our packages. We're giving out refreshments, we're doing giveaways, and we are giving one lucky guest that day a free package of all of the services.
Wow.
So, yes, you don't want to miss it.
Don't want to miss it. Okay, well, awesome. And if you would like more information about Femme Medical and Spa, we'll have their website listed below. And don't forget to check them out at their open house. That's this Thursday, May 22nd. We'll have their website listed below. You can come and enjoy a demo of their different products and also make an appointment. And thank you so much for tuning in today. We hope you enjoyed the show. And remember, you can always catch up on episodes and segments of Living Local 15 by going to WANE.com, downloading the WANE app, and also checking us out on YouTube. And I'll leave you with this. It's never too late to live your best life, so start living it today. And I look forward to seeing you here tomorrow. Bye-bye.
Content segments during today's Living Local 15 were paid for by these sponsors.